Tina, they are frontline heroes working through one of the worst health pandemics our country and the world has seen, caring for those most impacted by COVID-19. Today here in Scarborough, personal support workers came together to mourn their own. 3 minutes of silence this afternoon for 3 long-term care employees who lost their lives in the last few weeks. Christine McDagarian, Arlene Reed, and Sharon Roberts all worked at 3 separate long-term care homes and died in the last 3 weeks. Today, they're being remembered by their colleagues who say their deaths could have been prevented.
Nobody should go to work and go home sick at the end of their day because they went to work or end up losing their lives over it. They've been terrified from the beginning. They expected their employers and the government to protect them, to keep them alive. And some of the requests that we asked for inquiries today is to look back on that. Why so many deaths? There is absolutely something wrong in these homes that you've got 950 seniors dead and that we've got 3 frontline workers dead.
175 long-term care homes have reported outbreaks, and there are now just over 1,000 resident deaths. According to the healthcare union, there are 1,613 cases amongst long-term care staff. About 830 of them are members of the Service Employees International Union, who has been calling for the protection of these workers from the pandemic.
90% of these workers are women, and their families depend on them, their mothers, their wives, their grandmothers. They should not have to worry about whether or not they're going to be infected or whether or not they're going to infect their families when they come home at night. Absolutely. And I said it, if this was a construction site in a male-dominated sector, they wouldn't be going into that place to work. Why do we expect the women to do it?
And the union is also calling on the province to conduct an inquiry into the deaths of these 3 women, as well as residents living at long-term care homes, asking the question why these facilities were so badly affected.